Good afternoon, judges, and everyone present here. I, Dr. Mansi Doshi, student of MBA HHM, am honored to present our research topic, Dental Insurance, Perception and Attitude of General Population in Mumbai region, a cross-sectional study. In India, 85 to 90% people suffer from dental cavities, and we have the highest rate of oral cancer in the world. The solution to this is regular dental appointments. But the main hurdle that people face is paying out of pockets for the checkups. And this causes hindrance in seeking dental care. Unlike Western countries, in India, we do not have standalone dental plans. Here, the oral health is generally integrated with general health insurance plans, of which most of them cover dental costs arising due to dental emergencies and accidents, which require hospitalization. And a very few which cover regular routine procedures are very restrictive in nature, and they are not very well highlighted to the policymakers. So, with our study, we attempted to see whether dental insurance could help in reducing the people's negligence of the consumers in seeking dental services. The study aimed to assess consumers' perception, knowledge, and attitude toward dental insurance. For this, we conducted a cross-sectional survey among 384 individuals residing in Mumbai and Navi Mumbai. A sample size was calculated, and we self-structured questionnaire consisting of 15 questions, which collected socio-demographic details of the individuals and also their awareness, attitude towards dental insurance, and utilization of dental services. The data was compiled on MS Excel sheet and was analyzed using SPSS software. We found the association between independent risk variables with the chi-square test, and we set it p-value to less than 0.05. Coming to the results, the overall response rate was 63.5%. And this table here shows the demographic details of the study population. As we can see, 51.8% people belong to 18 to 27 age group, and only 3.3% people belong to 58 to 67 years of age. Our study had 155 females and 90 males. And when we categorized them into Kupuswamy classification, majority of them were found in class 2, that is upper middle class. On analyzing the responses, we found that 28.6% people went to the dentist last year, and here the significance was seen with age and gender. And 86.9% people agreed that visiting dentists annually is important. Association was seen with age and gender again, and these results tell us that people value their teeth and they want to seek preventive care. When we asked them about their preference to where they want to go for their dental treatment, they opted for private clinic, and they reasoned that it was very convenient for them, and the significance could be seen with the Kupuswamy score as well as the age. Here in our study, 54.3% people were not aware of any dental insurance policy, but when we asked them about the need in India, 78.4% people agreed that it is needed, and it was again significant with the age and gender. 69.8% people were ready to take the insurance, and they were ready to take it at a very minimal rate. In conclusion, also I would like to say that a Canadian study revealed that individuals with dental insurance had more favorable oral health-related outcomes overall across all income, age, and economic groups. So, similarly, dental insurance can also benefit the Indian population's oral health, as shown in a study, because the people are open to having dental insurance in India if the insurance rate is normalized and if they are better explained about it in detail. So the limitations of our study was there was no equal gender representation, and since the study was not done on a very large scale, the conclusion could not be uh, it could not be better concluded. In conclusion, I would like to point out that our study has given food of thought to the policymakers for designing and implementing dental insurance policy in India. If the dental insurance is made available in India, it will definitely change the consumer behavior and people will start taking prophylactic and preventive treatment which was completely neglected till date. It will also increase the awareness among people to seek dentists, and it will help us solve the issues with lack of utilization of service from the grassroots level, as dentistry is not expensive, but its neglect is. Thank you, judges, for patient listening and everyone present here.
Can you take out the slides of demographic variables?
Yes, sir.
Before that, even title also you can show. See, you have written the perception and attitude of general title. What is your title of the study?
So the perception and attitude of general population in Mumbai region, a cross-sectional study.
Next slide. Next slide. Could dental insurance help in reducing negligence of consumers in utilizing dental services? See, how, Miss, your question is, it looks like a confused question. You are writing the reducing negligence of consumers in utilizing the dental services. Miss, you wanted to say that it is a negligence related to the insurance or negligence related to the dental treatment?
So negligence, because of the costs that are there, they don't go to the dentist. They don't seek the dentist. So that is why if we bring dental insurance, would there be any change in the utilization of the services?
Okay. So next slide, demographic. See here, variable category, you have made the class interval 18 to 27, 28 to 37. Why this odd figure? Is there any reason for that?
So when we got the data, we classified the ages according to the data that was available. We had not predefined it in the age groups. So when the data came in, we could see that this was a better fit for.
And you have selected from 18, age group 18 to age group 70.
Yes, sir.
So the young age groups, the attitude may be different, and the old age group may be the different.
So yeah, that was the limitation I stated, that since we did not have equal age, gender and socio-economic
then why you have
representation.
very large range you have kept? You should have done it in the less
Yes, sir.
less age group, because see, dental treatment is usually it is the middle age or the old age is more. Even the nowadays, even young age groups also requires the medical insurance and medical treatment. But this middle age group is more prone for the dental treatment. So that was our question. And okay, is there anything?
I had a few observations. Like Sir said in the title, I would have been something like, instead of, it's a very negative, don't mind, the title is negative. So something like improving the awareness, of seeking. So it's, I would have preferred a more positive title instead of giving, you're calling the consumer negligent. I think it's a very sweeping,
So the research question.
It's not a correct, it's improving the awareness. I mean, think positive about this. Looks like a positive pilot study because the same question like sir is asking. You had some 300 odd people and only 63% finally.
People respond.
So basically, it was a questionnaire that was floated and you had no control. In the sense, I want to know, did you do any background literature search in existing data from India?
So yes, there are studies that are being done.
That would have helped you instead of making this as a pilot study. It would have been a structured study to calculate, the number,
Yes, sir.
study population, because right now it is still a pilot study.
Yes, sir.
And my third observation is that do you have any data on the educational qualification of the study population? And was there any change in behavior and their response? I mean, like you have age, gender, so because do you have any analysis on that based on the, up to 12 standard, somebody who's graduate, somebody who's postgraduate?
So we had taken Kupuswamy classification wherein their education, age and their economic status is considered. So based on that, we got to know that they belong to upper middle class. So their education is also like at 12th plus level.
Have you done any validity of the, you just show the question?
So I have the questionnaire.
No, I don't want analysis, you can just show. Because see, I have seen very few questions on the insurance.
So there were total 15 questions, but because the time limit was 5, we just got to put up
Have
only.
you done any validity of this questionnaire?
Yeah, yes, sir. The pre-validity was taken, pilot survey was taken, and then the questionnaire was floated.
How many questions were there for the only for the insurance?
So 4 to 5 questions were there for the insurance. 5 question was there for the utilization of services, and then 2 or 3 other questions were like in general.
Okay.
So I have the questionnaire if you would like to see.
It's okay. 15 questions are there.
Yeah.
An observation. You used Kupuswamy scale. So, first thing is they have this new virtual scale which has come up just recently.
Ma'am, since the data was collected then, the scale used that time was 2019.
Secondly, in Kupuswamy scale, you take education level of the head of the family
Yes, ma'am.
and the occupation.
Yes, ma'am.
You mean to say that all your respondents were head of the family members?
Ma'am, yes. No, because since 18 to 27, so they were not the head of the family members. Yes, ma'am. It's head of the family. Yes, ma'am.
Second suggestion is for all the students is please don't go for this knowledge attitude studies anymore. They have become very, very old. So please think out of box because attitude, lot of questions will come when you study because we scale having used for attitude.
Yes, ma'am.
Like scale and then reliability and validity.
Thank you, ma'am. Thank you, ma'am. Thank you, judges.
Thank you, Mansi, for giving light on the topic dental insurance. Next, we have Yuvashri Avi presenting on the topic Impact of Artificial Intelligence on Green Supply Chain Management.
Good afternoon to one and all present here. I'm Yuvashri, student of MBA Hospital and Healthcare Management. Our research is about the impact of artificial intelligence on green supply chain management. I would like to introduce my co-authors, Harini and Ahuna Mukherjee. Organizations these days are producing greenhouse gases. These gases emerge from emissions from logistics as well as because of the transportation that is required to maintain products. These gases will lead to global warming and eventually affect the environment. So, adopting a green supply chain is crucial. On the other hand, artificial intelligence will act as a tool and help in effective management and will eventually promote environmental-friendly supply chain processes. Manufacturing, distribution, and logistics are a network of functions that are vital for any organization and adds value to the customers. This chain of networks is called supply chain management. SCM is one of the crucial areas where businesses have a greater chance to show a positive impact on environmental-related issues. But supply chains contribute negatively to the environment as well. About 90% of carbon emissions occur due to supply chains. Because of this, it becomes necessary to emphasize green supply chain practices, which will help reduce the environmental threats. Green supply chain management is a new systematic approach that emphasizes environmental-related aspects of the supply chain management. Artificial intelligence is the potentiality of machines to imitate humans' abilities and act as a medium of communication. It provides real-time data which will help in risk identification and mitigation. Our research objectives is to explore the impact of artificial intelligence on green supply chain management and to understand the importance of green revolution in industries. Coming to the research methodology, ours is a secondary research wherein we use Scopus, Emerald, and Web of Science as a database to find research articles, wherein we included articles that talk about the use of AI in green supply chain management, and we excluded articles that talk about sustainable supply chain management. So coming to the results and discussion part, the significant issues in supply chain management are related to carbon emissions, supplier selection, demand forecast, communication among stakeholders, real-time data, logistics transportation, information sharing, decision-making, etc. Use of next-generation technologies like AI will help in reducing the carbon emissions associated with the supply chain management. Now coming to the benefits of AI in green supply chain management. Sustainable transportation. With AI, we can develop strategies for effective transportation that aims to reduce global carbon emissions. Real-time shipment location tracking. AI enables warehouse managers to constantly check their product's location by providing a consistent real-time information flow. With AI, we can also predict the product movement and arrival. With real-time information, shipment tracking and delivery information will help the companies predict the risk and alleviate them beforehand. It improves the potential planning. Big data analysis aids the supply chain managers plan for risk mitigation. AI will help control the data and will provide necessary warnings. This being a multifaceted field, simplifying data can be done with the help of AI. With AI, it also aids for us to make better decisions. Activities in a business entity that require manual intervention that can be made into an automatic system wherein we require minimal human intervention with the help of machine learning-based algorithms that acts as a tool for the decision-making process. Global greenhouse gases emissions currently stands about 53 gigatons of carbon dioxide equivalent. Meanwhile, BCG studies show that the potential overall impact of applying AI to corporate sustainability amounts to $1.3 trillion to $2.6 trillion in value, generated through additional revenues and cost savings by 2030. Let me tell you how AI in green supply chain helped the company. Recently, a global steel producing company wanted to optimize its production processes to reduce carbon emissions and also to lower cost. In the course of just 6 months, it implemented AI-based process controls designed to eliminate waste and to reduce energy intensity. Thousands of sensors collect billions of data points, which are then fed into the control system. This enables the company to precisely calculate and predict their energy needs, and it in turn reduces the source of waste. Since implementing these controls, the company achieved carbon emissions reduction of 3%, along with cost reduction of $40 million, a significant benefit for a company with revenue of $8 billion. AI would have a much greater impact on the industry as a whole, helping steel companies reducing their emissions by 5 to 10% and their cost by 1%. To conclude, India is moving toward becoming a net zero by 2070, as pledged by Prime Minister Narendra Modi to battle climate change. And as we said, about 90% of carbon emissions are from supply chain processes. So, organizations need to incorporate AI in their supply chain management to make it green. If AI is incorporated into the supply chain, it will result in numerous benefits, from reducing transportation to improved potential planning, which in turn will lead to enhanced decision-making. Using AI, we can achieve 5 to 10% of that needed reduction between 2.6 and 5.3 gigatons of carbon equivalent by 2030, which is an essential part in the concept of green supply chain management. I thank everyone for your patient listening, and we thank our faculty members for this wonderful opportunity.
So I have two very basic questions. You have reviewed literature data of about 80 or 90 articles,
No, sir.
73 Emerald and 12 Scopus.
That were the articles we found, and then we had an inclusion criteria and exclusion criteria. Just a minute.
The number of studies that you have mentioned.
Finally, we chose articles of 9.
Okay. So what I'm asking is this the algorithm that you followed?
Yes, sir.
Usually algorithms are a little bit more elaborate. That's why I'm asking.
Yes, sir.
Because I have written, because yours is a algorithm driven, if I may call it study. And then I wish you would have told us what were the key take-home points and whether there was a divergence of these studies, the recommendations or the findings that they gave. Because we heard you reviewed the literature.
Yes.
But what these studies spoke, there were only 9 studies. So I guess if you could tell us where they matched and where they diverged, not that I don't agree that all studies have come to the same conclusion.
No, actually, some talk about the challenges
Yeah, so I wish you would have done that. And my question is, what is your research question in the entire thing?
So we tried to explore the impact.
Take out your objectives.
Okay.
See, these are to explore the impact of AI on green supply. What is the observation then? What is your result on the first objective? To explore the impact of AI on green supply chain management practices. And another is to understand the importance of green revolution in industries. So these are the objectives, means it is your research question,
yes,
right? Sir. So we wanted to have the answer for this.
Okay. The first one, we came to understand that the AI on green supply chain management has a positive impact because we have many benefits from them.
How you have reached to this conclusion? What is your base?
After reviewing the data and from the articles, we came to understand.
So you just show the result?
This is the example I gave about. So this is a result discussion.
But this result is ambiguous. It's not a concrete result, no? From the 9 article, what you found out about carbon emission, what is the planning on decision making, what was there in that particular review papers, that has to be given. You should have made some tables or some graphs like this. That has to be there.
All the articles we saw was.
This looks like a review paper.
Okay.
It's like a review article.
Okay, sir.
So see, research is a focused one. Research should be what your questions, what are your objectives, and what is your answer. That's all the research. And what is your pathway to reach to that particular result. That is, some component is missing in this.
Okay.
Well, we are not saying you have not done any work. What we wish to see was a more concrete, thing where it could have been tabulated, and each study you write the whatever country, the origin, and what were the take-home points, and then you have to also talk about, when you're talking of research, the way forward or the take-home. Take-home you have still told, but it's very abstract. The way forward, because here you're talking of today's era of AI and machine learning. So we'll think of at least what is at the local, at the national or state level, regional, and how you would plan something so that the people sitting here, they can take home something back and think, okay, we'll carry forward the study here forward.
Okay.
So we didn't find that.
Okay. So whichever article we saw actually spoke about the benefits and challenges and opportunities of AI and green supply chain management. So that's why.
Present in the tabular form.
Okay.
as sir said.
Okay, like,
Understand ki so what was their sample, what was their methodology, what they found out. So that you have to do.
okay,
So
sir.
before publication, you have to just rework on this.
Okay, sure,
And
sir.
then you send for the publication.
Sure, sir.
Okay, thank you.
Thank you.
Thank you, Yuvashri, for giving us a light on artificial intelligence on green supply chain management. Next, we have Aditi Salunke with her presentation on the topic, Drones, the Smart Way of Delivering Healthcare.
Good evening, one and all. My name is Aditi Sanke from MBHHM and my team member is Karan Pandya. So the topic is drone, the smart way of healthcare delivery. Nowadays, global healthcare sector has continued to rise up with the technology to elevate the healthcare services. Even if this is the case, we need more advancement in the emergency sector to overcome the challenges like urgent medical supply and organ transport. A drone is a pilotless aircraft with the software flight protocols, and drone has recognized as a capable technology for healthcare logistics. A drone is a form of robot designed to be flown by controlling it with a distance using computer or devices. Drones are also referred to as unmanned aerial vehicle, unmanned aircraft, remotely piloted aircraft. So the objective are to study on how drones could be utilized in the times of emergency to improve healthcare delivery, and to summarize the current knowledge about utilization of drones in healthcare and future aspects. So the systematic review was conducted from the online databases like Scopus, Web of Science, and Google Scholar. Initial search result yielded 353 documents, from which we selected 181 documents of the based on the title, abstract, and subject area, by removing 172 documents because of duplication, year, language, and keywords like drone, healthcare, unmanned aerial vehicle, medicine, drones application. Then we selected 78 documents as they were available with the full text review. Then the 17 documents were selected for the final analysis with the inclusion criteria like relevant content and most citations. Yeah, so the potential use of drones in the field of public health is enormous and it is expanding. Finding indicates that the drones may represent a financially feasible means to promote healthcare and health-related services and for those in the difficult-to-reach areas. The benefits derived from the drones range from reduced response time during the health emergencies, thus helping to save more lives, and to being environmentally friendly. For better understanding, this is the example, comparison between hard transport time by roadways and by drones. So transportation time is given in hours on the y-axis, and the time of a day is represented on the x-axis. The blue columns are the road-bound vehicles, and the red columns are drones. A simulation using MATLAB software was performed to calculate hard transportation time between two different hospitals in Mexico City by road-bound vehicles and by drones. And the results shown that the drones take much less time to transport the heart in a healthy condition. Drones provide services in a short amount of time, shows faster and more efficient response, and also they are very cost-effective and budget-friendly. Drones provides accurate data, and they can be used in a challenge environment too. The major advantage is that they improve the transportation safety as compared to the roads by overcoming the challenges like poor road conditions, roadblocks, and traffic situations. Now, let's look into the application they provide. Drones have a potential to be a reliable medical delivery platform for blood products, tissues, vaccines, laboratory samples, emergency medical equipments, prescriptions, pharmaceutical products, medication, AED, and other essentials. They also help in organ transportation and can track disease outbreak. They offer telemedicine services and medical support to remote places, and they help in search and rescue operation and environmental monitoring, and also in infection monitoring. Now, concluding all this, drones have ability to completely change healthcare and medicine, as they have a potentiality of delivering emergency health services, which will be helpful to both workers and patients. Pandemic has given a push to this technology. Drones are predicted to expand to a greater extent as a result of recent advancement in the drone technology. So while looking to the first picture, question arises that how are we going to provide a treatment with the existing medical services? To overcome these challenges, we need more advanced technology, and drones technology can be a practical answer to it. Delivery of medical supplies is only starting stage, but in the future, most outpatient care and mainly home-related cares can be available. Governments can collaborate with the drone firms, PharmEasy and NetMeds in the future. Small kind of indoor drones can help to patient to transport a medicine from chemist to patient's bed or even to their homes. Drones can be integrated in buildings infrastructure and can make automated deliveries too. Drones delivery system and drone ports could be built in the close proximity to healthcare sectors. Thank you.
How many Indian studies you have included here in the 17 inclusion?
So there are 2-3 Indian studies.
In India, the drones are used?
Sir, in few emergency situations, they have did this process. One example is they transported heart from Mumbai to Delhi in the emergency situation.
Okay.
Yeah, even in the COVID times, the vaccine supplies are also done by the drones technology.
Okay. And in the US studies you have shown, it is only one case study you have included?
Yes, sir, it's an example of like reducing the transportation time. So basically, sir, a study between the two hospitals, the distance, and what are the time they are showing by roads and by drones.
Okay. So what positive factors you identified in this?
So drones are beneficial as they reduce time, they are more efficient.
But what are the factors which have the challenges to use the drones?
So I don't understand your question.
What are the challenges in utilizing the drone services for the transportation?
Yeah, we have challenges like infrastructure of the drone ports and their charging points. But I think that with the research and technology, we can overcome that. Yeah.
So, like sir said, 3 quick points. One, you could have had a slide on pros and cons based on the findings.
Right.
Or limitations and the advantages. Second is, if you could have given a breakdown or at least clubbed them together in 4 or 5 broad, headings, these 17 studies, their findings, it would have helped us. And you mentioned about its utility in infectious disease monitoring. So I'm interested in knowing how.
Sir, they help to track this infection disease. For example, I would like to say that even if one disease is spreading by the animals, so when they're tracking that disease, even there are places where human can't go. So drones can go there and track and see what is the condition and what can be done about that.
I mean, I didn't understand. If a drone goes and watches a bat or a pig or a buffalo, I mean, I'm trying to understand how.
And sir, with the infection disease, there are chances by getting infection with the contact. So we can supply medicine or supply the essentials to the area with the drones.
It's a transportation, it's not a monitoring of the infectious diseases.
Yes.
Monitoring of infectious diseases is a huge challenge.
Thank you.
Thank you, sir.
It is interesting to see the reach of technology in today's world. Thank you for bringing to light on such an interesting paper. Thank you, Aditi. Next, we have Jaspreet Kaur Sohal from Master of Public Health 21-23 batch with her presentation on the topic Mental Health in Adolescence.
Being able to be your true self is one of the strongest components of good mental health, as said by Dr. Lauren Fogel-Messi. A very good evening to everybody present here. I, Jaspreet Kaur Sohal, student of Masters of Public Health at Symbiosis Institute of Health Sciences, will be presenting on mental health in adolescents. So, as we know, mental health includes one's emotional, physiological, and social well-being. It affects how we think and act upon a situation. But when a little disturbance is caused in the soft and transitional stage of life called adolescence, then it leads to some certain mental health issues. The most important part is that we understand, we comprehend that how one needs to differ between mental health disorders and or from sadness, stress, or fear. There are many factors such as violence, poverty, exclusion from the society, environmental conditions, like living in humanitarian and fragile settings. So to decrease these mental disorders, detection and management is really required. So as you can look at this diagram, it has three important terms: prevention, treatment, and maintenance. Prevention has universal, selective, and indicated. These are the three terms under which we categorize the mental disorders. Then it's treatment, which has case identification and standard treatment, which means that the case, if it's identified at an initial stage, it should be treated, and if the treatment is known, the treatment should go on till the end. Then it's maintenance, which means we have to complete the treatment. Our goal is to the reduction in relapse and the reoccurrence. And then aftercare should be given so that the rehabilitation, or if it reoccurred, then it should be treated at a very right time. So this age group is where that interaction is very important. By here interaction, I don't mean that we're talking to each other. I mean the encouragement, support, and the positive attitude that we get from each of our peers and colleagues. But this is lost.
Can we
Yes,
go
sir.
to the aim and objectives quickly?
Yes, sir.
I said go ahead to the aims and objectives.
Ahead?
Study proper.
Okay. Okay. So as I've talked about my topic, my research question is that what are the effective interventions to promote mental health among adolescents? My search strategy was I used the keywords intervention, adolescent, and mental health. Databases were PubMed, Medline, Scopus, and Indian Journal of Community Medicine. The time frame was 2010 and 2021. The reason being because this shows the highs and lows of mental health in adolescents, and specifically it has the time period when the world was under the global pandemic. So for a literature review, this is a study which I saw in one of the papers, which was conducted in 2015 and 2016 by the National Mental Health Survey. And this was resulted that how 7.3% of these psychiatric disorders such as anxiety, depression, personality disorders still are seen in the age group of 13 to 17 years old. The main findings or the results of this were that psychological distress, depression, and anxiety, they are strongly indicators of social capital. Here, by this I mean to say that there are young people who don't have good relations with their peers. They might be thinking that they're not wanted in the society, but that is the mindset that needs to be changed. And studies have also shown that how COVID-19 has increased the prevalence of mental disorders among females and adolescents. And as we know, COVID has a very specific guideline, physical distancing, but this has also increased the peer interaction, which is very vital aspect in this development. In the end, I would like to conclude that this age group goes through a lot of monumental changes, and when they transform from childhood to adolescence and to adulthood. So it is our duty to take care of the positive and promotive mental health in this age group so that they have a smooth progress towards their adult life. Parents and caregivers, as they are the ones who are close to us, they need to be explained how to recognize and appreciate this development stage. and programs should be carried out to strengthen the weak ties between the families and the adolescent. The reason being that at this time, they have emotions like anger and disagreement. When parents object, they think they're not being listened to. But that is what needs to be proved wrong. And home environment plays an important role because by the end of it, they are sitting with their family and they are the ones whom they can open up with. Thank you.
So, my first query in your introductory few lines, you said especially that you did from 2010 till 21.
Yes, sir.
And you made a mention about pandemic. So, do you have anything analysis on before and after the pandemic? Before pandemic, was there a difference when the pandemic started before that and after it happened?
So I don't have a graphical representation to give you right now, but what I can say, when I've gone through the papers, I think at this time before the pandemic, the parents were not giving so much of importance. But when I think we've seen in the news also how the parents are they're seeing their children, they're sitting in the household and they can't go beyond. They're getting irritated. So that was the time when they actually saw that this needs to be given importance. And first of all, there were so many cases when parents were reporting that our children, I think they are not.
So, in a loose term, COVID brought them closer.
Yes, sir.
Okay, and second is, why did you choose 2010 as the cutoff?
So I have used it. I have used from 2010 to 20 as a rough idea. I will be giving that time frame. But there are articles which I have taken from 2010, and they have a gap of 2 to 3 years. So to give a time frame, I've said 2010 to 2021.
Okay, ठीक है, thank you.
Thank you, Jaspreet. And finally, we have Kruti Joshi, MBA 2022 batch, with the presentation on the topic, Study of Digital Health Market in China and Japan.
Good afternoon to one and all present here. I understand that it's long, but I assure you that this is going to be interesting. So I'm Kruti Joshi, a student of MBA Hospital and Healthcare Management, batch 2020-22. And I'm here to discuss with you all and understand the factors for the implementation of digital health services in China and Japan. This is a review study. So first of all, just to put it into simple terms, digital health refers to Digital health simply refers to the digitization of all the means by which healthcare can be provided. So it is an umbrella term which comprises of various words like mHealth, eHealth, electronic health records, telemonitoring, etc. Now, coming to why I've chosen specific geographies, that is China and Japan, for the study. So the Asia-Pacific region, which is the largest on the planet, is also expected to witness the largest growth in terms of digital health services in the coming decade. And this growth is attributed to countries like China, who have a large population and the strongest economic growth in the region, and countries like Japan, which are the most technologically advanced nation in the APAC region, and they also have 100% universal health coverage, which makes it very easy for digital health services to be launched and used. So the aim of the study, as I mentioned earlier, is to study the digital health market landscape with respect to the implementation of the services in the selected geographies. The objectives are to understand the market drivers, those are the facilitators, the challenges and the opportunities in this market, and lastly, to some extent, also understand the legal framework surrounding the digital health means in these countries. So, coming to the China market, so as I mentioned, the Chinese market is expected to grow by a CAGR of 23% by 2025, which is the highest growth rate. The growth is attributed to three major factors: the aging population of China, the rising chronic disease burden, and the urbanization, which is to some extent also prompted by the quick Chinese government actions and increased demand for services. However, one major drawback of the Chinese market is that it is a highly regulated market with very stringent laws.
And of course, there are a lot of opportunities, for example, the disparity between the urban and rural health services, the changing demands, and the rising healthcare costs. Coming to the Japanese market, Japan is one of the fastest aging economies in the world. Its population is expected to be 35% of the population is expected to be of 65 years age up to 2040. And of course, it is the most technologically advanced market, as I previously stated. The challenges in the Japanese market are there's a cultural barrier because of rising age. People are not able to grasp the digital health services provided, and also there is insufficient database with respect to the digitization of health services. But the opportunities are abundant considering that it is the mature healthcare market, and one biggest advantage is that Japan has the highest healthcare expenditure in the entire Asia Pacific region. That is, they spend 11% of the GDP on the healthcare expenditures. So, concluding the study, we already saw the comparative factors. So one of the major questions was that how do we penetrate these markets? How do we implement the services in China and Japan? So for that, digital health services are obviously cost-effective solution. And as those who were present in the previous session know, that one of the major challenges that healthcare faces right now in developing and to some extent in developed nations also are access and affordability. So digital health services are a means to kind of save us from both of these challenges. We have better access to larger population, which is a classic example of China and India as well if we want to implement. And then, of course, cost effective as in terms of Japan. So with that, I come to an end. Thank you, everyone, for listening.
Why you selected China and Japan?
So like I said, my study was mainly focused toward the Asia-Pacific region, but then Japan has the highest GDP in that region. China and Japan has the highest healthcare expenditure. So both these markets are very lucrative for investors and also for researchers to study that how the factors play there, and then they could be implemented in whichever home markets if necessary.
So what is the social relevance for this for India?
Sir, for India, there are social relevance from both the countries. China, because they are the highest, the most populous country, and we are the second. So in terms of, accessing people not having access to the health services, digital services can play a major role. And we can adapt and learn from China's way of implementing of how we can implement it here. And in terms of Japan, in Japan, people are very excited to use new digital services, which I also think is the case for India, that we want to try new services which give us better and cost-effective means of solving our health issues.
But for the demography of the China and Japan is not reaching to the India, and it's not comparable with the India.
Yes, sir. If seen literally, it is not. But then, like I mentioned, the two factors that I selected were the base. So that is why I considered. And sir, yes, one of the limitations is one of the recommendations is that this study could be expanded into the Indian subcontinent as well to understand which factors actually affect India.
Just one point. As a research paper presentation, we would have expected you to show us the methodology based on which you reached, these findings and conclusions.
Sure, sir.
So we wish you would have shown that, you have shown the facts and figures, but before that, the methodology, what exactly, how you went about, which studies, what are your sources?
Algorithm.
From the algorithm, which are the sources? Is it, starting from a review article to Wikipedia to some blogs? We don't know.
Yes,
So that is amiss. The methodology is very generic, what you have written. But we want a more structured, because we also understand how you have gone about it.
Right, sir. Okay. Thank you, sir. Thank you, everyone.
Coming to the end of this session, we have realized that presenters have kept their minds ignite with research and current knowledge, and throughout this session conveyed to all of us. I would like to thank all of them for sharing their knowledge and wisdom. I would like to thank all the esteemed judges for their valuable time and making this session a true success. Thank you so much.